Hello, I am going to present about the topic CBCT in endodontics. Cone-beam computed tomography is a contemporary three-dimensional diagnostic imaging system designed specifically for use in the maxillofacial skeleton. It is accompanied by using a rotating gantry to reach an X-ray source and detect the artifacts. It captures a cylindrical or spherical volume of data described as the field of view. The 3D volume data is basically obtained by using a sensor rotating 180 to 360 degree around the patient's head. The classification of CBCT according to the dimensions of the FOV and scan volume is as follows. Small volume for FOV height is 5 cm, single arch CBCT scan, interarch CBCT scan, maxillofacial CBCT scan and craniofacial CBCT scan. For endodontic application, we use large volume CBCT mainly for the following reasons. Increased resolution to improve the diagnostic accuracy of endodontic specific tasks such as the visualization of small features including calcified or accessory canals, missed canals, etc. High possible resolution, decreased radiation exposure to the patient, time saving due to smaller volume to be interpreted, smaller area of responsibility, focus on anatomical area of interest. The radiological aspect of CBCT are obtaining the image. Ideally, the arm rotates 360 degree around the patient's head with scans time between 10 to 40 seconds. Since X-ray beam is pulsed, the real exposure period is 2 to 5 seconds, resulting in as many as 580 milli exposures of projection images throughout the scan. There are three observational planes. They are coronal, sagittal and axial as follows. Specific requirements for endodontics are high detail, high resolution and small FOV scans. The limitations of the CBCT are compression of three-dimensional structures, geometric distortion, anatomical noise, and temporal perspectives. The conditions for the acquisition are voxel and field of view. Voxel in CBCT, a voxel is defined as the smallest viewable part represented by a cube, which the digital 3D image data can be divided into the smallest 3D element of the volume. Unlike the pixel, with only x and y coordinates, the voxel also has a z coordinate providing depth. Smaller voxel sizes are related to higher resolution. Voxel values between 76 micrometer to 300 micrometer are therefore recommended for endodontics given the structural characteristic of dental, pulp complex and periapical tissues. Field of view. The smaller the scanning volume, the higher the spatial resolution of the image and the lower the radiation dose and the reconstruction time needed. Therefore, small FOVs are recommended for diagnosis and treatment in endodontics. Applications of CBCT in endodontic practice are as follows. Detection of apical periodontitis, assessment of the outcome of RCT, management of dental trauma, assessment of root canal anatomy and morphology, diagnosis, assessment and management of root resorption, and diagnosis of vertical root fractures. In endodontics, voxel size less than 200 micrometers are used. For endodontic therapy, the use of limited FOV with effective doses of 13 micro SV for mandibular anterior teeth, 11.7 microsieverts for mandibular molars, 44 microsieverts for maxillary canines and premolars, and 7.4 microsieverts for maxillary incisors are used. CBCT imaging interpretation in endodontics is carried out as follows. Correct the data. Initially, the data has to be corrected by adjusting the orientation such as the axial, sagittal and coronal views. View the data. Due to the large number of components of orthogonal images in each plane, it is necessary to review each CBCT analytically by scrolling through the orthogonal image. Display the data. The CBCT software offers several display options, all focused on highlighting specific components of the volumetric dataset. Raysum or raycasting, an MPR image can be increased in thickness by increasing the number of adjacent voxels. This creates an image slab that displays a specific patient volume referred to as raysum. Volume rendering. It refers to techniques that allow the visualization of volumetric data by integrating large volumes of adjacent voxels and a selective display. The artifacts associated with CBCT in endodontics are noise, which is defined as a result of inconsistent attenuation values in projection images derived from rounding and photon counting errors. Scattering caused by photons diffraction from their original path after interaction with matter, resulting in an increase in measured intensities. X-ray beam artifacts that arise from the polychromatic nature of their projection lead to beam hardening, which is the increase in average energy as a result of low energy photons being absorbed instead of high energy photons. Motion artifacts, in which a misalignment occurs either of the sources, the object or the detector effect, that causes inconsistencies in the process of rear projection. So, to conclude this, however, CBCT imaging comes at the expense of increased radiation dose. Therefore, should be only reserved for cases where there is potential benefit from a three-dimensional assessment. Thank you.